the ladies and gentlemen in the house. Welcome to today's edition of the Bit Learning Network webinar entitled DHIS2 Tools for Immunization Programs with a focus on apps and dashboards. My name is Catherine Muyawala, the Bit Learning Network Coordinator, and I'm your host for today. Before we begin, I would like to share some housekeeping guidelines. Would really appreciate if you could type your name and country where you're connecting from in the chat box. And if there are more than one person on one connection, would appreciate you including just the number, not necessarily the name, but the number of other persons who are sharing the same connection as you. All participants will be muted. This is to allow for the speaker to present without interruption, and the video is also disabled so that we don't disadvantage other participants' bandwidth. Then there will be a question and answer session at the end of the presentation. So we are accepting questions that can be submitted in the chat box, and these will be logged and answered during the question and answer session. And also just to let you know that the webinar is being recorded and that the link to the recording and the slides for the presentation will be shared through the Bit Learning Network website. So just to let you know that this webinar is being hosted by the Bit Learning Network, which is also known as the BLN. And the Bit Learning Network actually bridges countries and regional as well as global partners that might be interested in strengthening their health data management systems. And this is done through peer learning, mentorship, skills building, advisory services, and knowledge management in digital health solutions. And the general audience for the webinars include, but they're not limited to, policymakers, funders, EPI managers, health information system specialists, data management specialists, healthcare workers, and all health specialists, healthcare specialists who have got an interest in data management. So what are we discussing today? Today's topic is on DHIS2 Tools for Immunization Programs. And like I mentioned, the focus is on apps and dashboards. As you may know, the global and national stakeholders have acknowledged that routine immunization programs face significant challenges in relation to data collection, analysis, availability, and use for planning, management, and improvement of program performance. Now, to address these data challenges, the World Health Organization, in collaboration with the Health Information Systems Program in Tanzania, developed an information data quality application, which is suitable for low-income countries using the District Health Information System, which is popularly known as the DHIS2. So today we will get to hear more about this tool, about how it works and how it can be applied to immunization programs for data analysis and dashboard use for decision making. And our speaker will also share lessons learned from countries that are using this application. Just to share a little bit more information about our speaker in the house, we have Mr. Ismail Yusuf Kololeni from the Health Information Systems Program in Tanzania, where he is a DHIS2 implementation advisor. And Ismail has 10 years experience in the development and implementation of health information systems using DHIS2 software in Eastern and Southern African countries. And he's been supporting both government and non-governmental organizations in setting up these systems. And his area of expertise is software development, data analytics, data use, as well as capacity building. Ismail holds a Master of Science in Health Informatics. Welcome once again, Ismail. And may I invite you to take the floor? Would you like me to share the screen for you, or are you going to do it yourself?
Thank you, Catherine. I think I'll try and share from my end.
Okay, in that case, let me stop sharing.
Yeah.
Okay, I've stopped sharing.
Unfortunately, I can still see your screen.
My screen. Okay, let me stop sharing. It's refusing to stop. Can you imagine that? It won't stop sharing.
Can you see mine?
Not yet. But it's indicating that you started to share. Okay. Okay. It's visible now.
Okay.
The floor is yours.
I hope you can see my screen now.
Yes, perfectly.
Okay, great. So thank you, Catherine, for the brief background and introduction. As Catherine mentioned, I'm going to be talking about DHIS2 tools for immunization programs, and of course the focus on more on the use of apps and dashboards. Just as a quick background, as we all know, DHIS2 stands for District Health Information Software. It has a very long history towards the implementations of information systems, health information systems, particularly in many countries and low resource settings, so more or less developing countries and third world countries. It has become very handy and very popular. And over the past few years, I think it did gain very wide use, particularly from the Ministry of Health in across African continents, Asian, and of course some of the Pacific and Southern American countries. And the use did vast from the national health systems, HMIS, also by the use of different programs like immunization, TB, malaria, HIV, as well as used by other implementing partners and other partners who are working in the health sector, as well as, of course, other sectors also started using DHIS2. So it's been a very popular software as far as the health information systems is concerned. And during this period of the use of DHIS2, particularly in many countries, how DHIS2 work, each country adapts DHIS2 depending on the local context and the local health information systems need and the local tools. And that leading to, of course, various of changes of how DHIS2 is being used depending on the country and organization, and of course, just like any other information systems, will be different depending on the context. But there was this, if you're looking more on the high level global scale, there was always a need for better coordination and strengthening, as well as partnership in common use of the data, and also spearhead and accelerate the use of information, particularly for action and decision making. And towards trying to achieve this, there was, of course, an assessment that was done in many countries. Of course, did see that there was a certain level of use of information, but it was somehow not to the very highest level, the way that many stakeholders would prefer. So there was this initiative to sort of have DHIS2 digital data packages, and these packages were mainly meant to have set of standards of the use of information for particular program, health programs, and also by the use of other partners through across different levels of the hierarchy. And this was an initiative that started by the World Health Organization, WHO. And of course, they didn't only focus on DHIS2, but mostly the focus was to have the data analysis and use guidelines. And these were categorized in many different programs. So there was a couple of documents. If you visit this link that is on the bottom of this slide, there is a couple of, it shows many guidelines that WHO released for assisting countries and being able to set standards of how countries need to use their health information systems for data analysis. And these guidelines were more or less categorized in many categories as per the programs. So it started with, of course, different programs like HIV, TB, malaria, immunization, and then there was also other areas like RMNCH. So there are many guidelines. Now, towards utilizing these guidelines, there was sort of that connection of applying these guidelines to effectively use. And that is where DHIS2 comes in very handy, because most of the countries that were intended to use these guidelines were already using DHIS2. So that is where it was also necessary to sort of build, instead of going to every country DHIS2 and develop specific dashboards for each country or each DHIS2 instance, and then it was best to have like a standardized digital package that these countries can just take and adapt it within their DHIS2, and so install the packages and get those data analysis dashboards and other components of the data analysis running within their DHIS2 instance. And if they choose to maybe make different adjustments, build on top of that, and of course, every country and every application is free to use that. So in addition to these guidelines that WHO developed, data analysis guidelines, the University of Oslo, in collaboration with different HISP, health information system programs in different countries, did collaborate with WHO to develop these DHIS2 digital data packages that were mainly focused in sort of replicating the recommendation of each guideline into a DHIS2 digital tool. So we did develop a couple of metadata packages that could have been easy for being made public and easily being adapted in many DHIS2 instances for all the countries. And these packages are the ones that are listed here. So they are for, as I said, HIV mortality and morbidity packages, HIV, immunization, TB, malaria, RMNCH, and also there are other programs and packages being developed for example, for cross-cutting dashboards and other, cross-cutting programs and so forth. So these are still under development. So yeah, so basically this is how, from the generic space, there are different DHIS2 digital data packages. And of course, I didn't put in this slide, but there's also very latest package that was just released, the DHIS2 package for COVID-19 tracking. So it sort of covers all the end-to-end case-based surveillance from for the COVID-19 patients. So this is all different initiatives that WHO and other stakeholders and partners in collaboration with DHIS2 implementers and technical teams trying to put together and have these packages available for the countries that would want to use them within their own DHIS2. So in a nutshell, if you do a fresh install of DHIS2 now, none of them will come with all these metadata packages and data analysis tool. So you have to go to these links and being able to download these packages and install with the DHIS2, because they don't come with off-the-shelf DHIS2. And of course, if there's another advantage of these packages is it combines the data capturing tools as per the WHO standard guidelines, but it also has the outputs in terms of data analysis, data quality and validation rules and stuff like that. So it sort of creates that template baseline, even for a country that starts using DHIS2 and they do not have these standardized tools yet, and then at least they have a base place to work, to start working from in terms of adapting these packages that covers that minimum requirements of how data should be used for each program. As I said, if there is a need for, depending on the context, depending on the country, if there's the need to adjust and improve, and then the packages are very much open to that. But of course, that will not affect the original digital package. Yeah, so that is kind of the background. Now, for today's webinar, I'm going to be very specific to immunization, although just to have you aware that there are other programs and other tracks of these packages out there for use as well, not necessarily limited only to immunization program. Now, for immunization, I'm going to talk about specifics of what the content of this immunization packages contains. Now, as I said, most of this package was developed as a background from the data analysis and use for health facility guidance. So this is a work document that WHO released in February 2018. And it has like different standards and sets of data and on how immunization data should be used, what indicators should be tracked at what level, what types of visualizations, what types of data quality controls the immunization programs need to have in adaptance and stuff like that. So together with this guidance comes with the DHIS2 dashboard package. Now, for most of you who had already seen DHIS2 before, you know, of course, when you log in for the first time, there's this dashboard that gives you different types of analysis and visualizations on the login screen. Of course, it takes the data that is being captured by each program. Now, there's this immunization dashboard that can be installed. And of course, if you had already inbuilt immunization tools, that means you need to map this dashboard with your specific indicators or data elements from your local DHIS2 instance. Or if you're adapting the full package, it means it comes with the data collection tools as well as the output of the analysis. So essentially, this is the front end of the first step where any program manager or immunization data user will log in into DHIS2 and see this kind of visualization. So this combines charts, graphs, maps, different level of data tables, and it sort of mimics all the outputs depending on the indicators that has been mentioned on this guidance for immunization program. Most of these are being displayed in this chart in various formats. So, for example, if you look at this slide deck here, I did pull up a screenshot. This shows tracer vaccine coverage. So there are a couple of vaccines that shows the tracer for the past 5 years. And the next chart shows DPT1 and DPT3 coverage by all the districts. So essentially, this is more or less from the, you more focus on 1 year, one vaccine, of course, DPT 1 and 3, and the coverage. So you can see how, you can even see what's kind of the dropout for each district. And of course, there's also some map visuals that says like what's the coverage, and these maps are color coded for each of the visualization. So that most of these screenshots are coming from what we had called Demoland. So Demoland is kind of the country we created, a virtual country that is not linked to specific any country, because these dashboards are very generic. Once you apply into your own country, it means that all the outputs will be categorized. If it's a district, it will be linked to a particular district in that particular country. Similarly, apply for the region and so forth, as well as the maps. But for the purpose of this presentation and the demonstration of this packet, we use this virtual country called Demoland, which has basically 2 regions, animal and food. And then it has a couple of districts, as you can see here. For the animal districts, you have bird and cat and dogs. Those are the districts. And then we also have food districts like sweets, sepal, dessert, and stuff like that. So this is all made up, but it's sort of to show the sense of what kind of visualization are available. But once you install this in a particular country context, it means everything will reflect depending on that particular country's setup. So this is one of the example of the content of that dashboard package. Another example, of course, of the data that is being displayed is, of course, the reach of also facility stock indicators. So you can not only track data like coverage, coverages, dropout, and stuff like that. You can also be able to monitor stocks of data. And this can be done by different visualizations, like you can see maps and you can see where the stockouts are in your map. A good example is from the first image of this slide. But also you can see, like, depending on the month of stock, you can see color coded, and you can be able to pinpoint which facilities are overstocked, which ones are understocked, which ones are adequately stocked, and so forth. So these are all different different types of visualizations that should help the program manager be able to identify and act depending on the screen. So for example, if you see a facility is stocked out for a certain vaccine, and then they need to do something, and the fact that this brings up with the color-coded data displays, they can easily, in a data table, you can easily see where the reds are, which of course calls for immediate actions, and you can even choose to make actions out of that in terms of deciding maybe you should either resupply or reallocate some of the vaccines from the nearby facility and stuff like that. And to put this in practice, of course, this is also for the countries that has really implemented this dashboard. It has been a big game changer, because Before they used to, of course, make a lot of phone calls. I'm out of vaccine, and there's no good data visuals for the program managers. But with this, the use of dashboards, at least program managers are getting this monthly level of data that they're able to access and make decisions or act depending on the data that they have. And of course, you can also track consumptions of data. So these are just snapshots of different types of visualizations that are available in this package. So you're not only monitoring service level information, but you can also monitor and analyze stock level types of data. Just back to this slide. So this is overall DHIS2 classic dashboard that any DHIS2 would have, of course, in terms of the dashboard itself. But these visualizations are made custom for this particular package. And of course, they can be linked to a particular data collection tool in a specific country. Now, in addition to these visualizations, DHIS2 supports, of course, it supports data analysis in terms of, as I said earlier, charts, different level of charts, maps, data tables, and this kind of standard visualizations, the one I've just shown in my two previous slides. But for immunization specific, the immunization specific program has quite a couple of data analysis visualizations that are not 100% supported by DHIS2 visuals. And during the implementation of these guidelines, of course, you would see that in the guideline that there are some quite number of visualizations that you cannot reproduce those visualizations by off-the-shelf DHIS2 functionality. The advantage of DHIS2 as a platform, it allows to create different apps where you can now technologically build custom things on top of the DHIS2 platform. So that is where the community decided to develop this immunization analysis app. Again, this has been done in very close collaboration with WHO in terms of setting up specific requirements for this analysis app. So this is an app, and when I say an app, I mean from the top of anyone's head, they will think like a mobile app that we normally use in our Androids or iPhones. But this is an app in the DHIS2 context, meaning if you log into DHIS2, when you go to the apps, you will see the normal dashboards, data entry. You can see these are the apps that we normally have in DHIS2, that any DHIS2 installation would have. But in addition to these usual apps, you can install or you can adapt additional apps in DHIS2. Now, these apps can be developed just like the way you have your phone, and it comes with the standard apps, maybe to send emails, send texts, and make phone calls. Those are the apps that come with off the shelf with your brand new phone. But if you want maybe an app to track your exercises, and then you can go to Play Store or iPhone iStore and download that particular app. So it's the same applies for DHIS2. There's DHIS2 App Store, where all of these apps that are being developed are published, and you can download and install that app within your DHIS2. So one of the examples of these apps is Immunization Analysis App. Why Immunization Analysis App? Of course, DHIS2 has data visualizer. It has pivot tables and GIS components that supports some basic analysis, something what I just showed on the previous two slides. But as I said earlier, there are some specific types of data analysis that are not 100% supported by DHIS2. A good example is this visual that I have here, where, for example, this chart, which plots different categories of immunization for coverage and dropout. and it sort of maps the facilities in this plot in this charts. So this kind of, for a program manager, most of them would like, this is something they normally use to sort of analyze which part of quadrants every facility is. But unfortunately, you cannot develop or you cannot reproduce this with core DHIS2 off-the-shelf functionality. So that means this is why this apps comes handy, where you can be able to get all the specific immunization types of analysis, being able to reproduce and get these visualizations of that are very specifically catered for immunization programs. So this is what the Immunization Analysis App has to offer. Again, this just to emphasize, it's an app in the DHIS2 context as a platform, and not the usual apps that we are usually thinking about when we use our phones. This is just an example of one of the visualization. There are a couple of other specific immunization charts that can be produced by these apps. Not only charts, but also data tables, and you can be able to drill down and reshuffle the tables in a very specific manner that would make sense to immunization program managers. So this is another tab. In addition to earlier dashboard, there's this Immunization Analysis App that is widely used and installed in various DHIS2 implementations in countries. And this is only to help the EPI program managers to get that specific visuals that DHIS2 does not support. But most of these visuals are recommended by WHO immunization analysis guidance. So that is Immunization Analysis App. Another level of app that that DHIS2 offers, it's what we call a data quality app. Again, similarly to Immunization Analysis App, this is an additional app that does not come with off-the-shelf DHIS2. DHIS2 has little bit of data quality functionality by itself. We call them validation rules and consistency analysis. But it's very specific and in a very logical manner in terms of you can only do maybe you have tested 5 people, you cannot have 10 people tested positive. So that's illogical. So in a normal DHIS2 environment, you would set up a validation role to be able to filter those kind of data and give maybe error messages and alerts for that, but also monitor maybe timeliness and completeness of data. And that's it in terms of the basic DHIS2 data quality functionality. Now, when it comes to WHO, there was also data quality review guidelines that is part of this guidance for data analysis that WHO had released. And into that, it had very specific ways of monitoring data. Of course, looking at data completeness and data timeliness is one of the ways. But also there are some specific mathematical models in terms of monitoring consistency of data, depending on the seasons, depending on different circumstances, depending on different situations, and stuff like that. So this is what this app was developed for. Most of these functionalities in this app are not available in the normal DHIS2 data quality functionality. But if you use this app, and then you get that advantage of looking at consistency of data, figuring out from, for example, outliers of if there's a potential, maybe if the facility is used to give 15 or 20 vaccines a day or a month, and then all of a sudden if they give 1,000 vaccines, and then that in one particular month, then that should be an issue. So this kind of data consistencies can be monitored and analyzed through this app. But also you can be able to combine that with the completeness of data and of course timeliness of data, but also have this kind of specific visualizations, for example, for dropout. If you look at this chart, it shows Penta 1 doses given for and Penta 3, and you can compare that in dropout. So you'll be able to see which facilities had dropout, which facility had negative dropouts and positive dropouts and stuff like that. Most of these are to help the data managers figure out where the data problems are in terms of what are the areas that had data quality issues. And this had really, this app had really being a game changer, because most of the people, I mean, on the early stages of DHIS2, people are really thinking about completeness of data. So they just report data for the sake of reporting. With this data quality tools, it helps like digest that data, monitor consistency of it, and be able to give the program manager, okay, based on the trends, based on the time, based on the seasonality, this facility should not report in this kind of number. So it's kind of building, it has that intelligence of monitoring. Of course, you need a certain range of data to be able to do that, but it has that assistance in helping program managers figure out where the issues are. So yeah, so it has many types of visualizations, tables, but all of them are around data quality and monitoring consistency of data and display what are the potential. It's not necessarily errors. I understand there could be other reasons. For example, like there could be a campaign, and then suddenly the number of immunization rises up. So they should have an explanation. The point of this app is to help a program manager at least identify that something might be wrong here, and if it turns out to be a good thing, and then it's fine. So yeah, so that's all about this data quality app. So in terms of the package for immunization, these are kind of the essential ones. So there's this standard package, dashboard package, that is the usual DHIS2 dashboard functionality, but it's been tailored for different immunization data dashboards. And then for some of the visualization that are missing, there's Immunization Analysis App. And also for data quality, in addition to the usual DHIS2 data quality functionality, there's WHO data quality functionality, that data quality app that supports more extensive data quality analysis. But of recent, this was more of the last year initiative, 2019. So this is a very latest stage of the support. We did introduce what we call bottleneck analysis apps. This is quite an interesting but new concept, not very new theoretically, but in the DHIS2 space. So this bottleneck analysis is kind of a new way of trying to look at the data in more of a bottleneck analysis perspective, where you look at different levels of data, different sources of data, and be able to identify where the bottlenecks are and act on those bottlenecks. So the BNA analysis looks at, for example, human resource data, commodities data, geographical accessibility, because these are the aspects that could have an impact. You can look at the service level data, for example, how many children are being immunized, maybe by BCG or Penta 1 or Penta 3. And you can see the numbers are, of course, maybe high or sometimes low, but you don't really know why suddenly there's a very high dropout rate, for example. It could be maybe there's no commodities, or there's no sufficient staff, or probably the facilities is not very accessible. So these are the different aspects of data that normally when we look at the service level kind of data, we sort of analyze the service data the way it is, but not take into consideration the other parts of that could lead into be a bottleneck for that particular indicator that you're monitoring. So the bottleneck analysis was, as I said, it's kind of a new area of analyzing data, at least in the DHIS2 world. I know theoretically it's a very long theory, but in terms of DHIS2, so there's this app called the BNA, or Bottleneck Analysis App, that has been developed. And this has been made just like for the data quality app and for the immunization analysis app. This is another set of app that brings the custom way of looking at data in more of a different areas of aspects that you can monitor your indicators for. So you look at not only the service level data, but you look, okay, how are we doing in terms of the commodities? Do we have enough? Do we have enough stock for that particular vaccine? Do we have enough staff to give that particular vaccine? Do we have, is the facility accessible, and other tools? So these are the kinds of analysis that should be bringing in. Of course, these kinds of expose the data analysis into different sources other than routine data that is being collected on maybe monthly or quarterly basis. So it opens up the aspects of interoperability, which I'm going to speak about next. But the idea of this bottleneck analysis app is not only to look at specific indicators that you're monitoring, but to sort of look at that in more of what is the bottleneck that could be a lead for that particular indicator. So how the workflow of this analysis, how it works is it starts with the basic scorecard that's been pretty popular in many countries in terms of analyzing data. The one that you see here, down here. And if you see an area which has performed red, it means that's a poor performance. And then you can choose to sort of drill down that and combine this other level and see why is it red. So if you see maybe facility has a very high dropout rate, so you can click at that facility for that particular period and see how was the staffing, how was the availability of stock on that particular time, how was geographically accessibility, because there's also the aspect of rain. Sometimes the depending on, I mean, developing countries, when it rains and then the roads are closed, people do not get to the facility and stuff like that. So these are all different ways of giving the health program manager data that could be help them to make an informative decision or figure out what is really happening out of that data. So in terms of the all these apps that I've just talked about, from the digital data packages, DHIS2 data packages that are available, which brings up the dashboard for data analysis, the immunization analysis apps, the bottleneck data analysis apps, the WHO data quality apps. All of this brings now to having an integrated data analytics. That's more or less the point. So as I said earlier, if you have like a comprehensive use of all of this package, that means you're not only looking at one source of data. Some of these packages require data from other sources like human resource, information systems, of course, immunization registries, some other data fetches data, population data, and other maybe campaign supply chain data, and sort of that. So all these are different kind of data inputs that can be consolidated, either manually entered into DHIS2 via users login and input that data, but also it can be, if you have maybe another system that operates in the country that can be interoperable with DHIS2 to be able to give that data. For example, in Tanzania, we have integrated DHIS2 with a couple of other systems like Human Resource Information System, some immunization systems and others. So all of this feeds up as an input in addition to the normal HMIS data that is being captured by districts people into DHIS2. There's all this set of data, logistics data, immunization data, population data coming into DHIS2 from other sources. So it brings up that interoperability level of data, but also you can have other maybe campaign data in Excel, Access databases, and all of this can be uploaded to DHIS2. And of course, that can give that by the use of all these tools that I've just presented, an integrated analytics perspective. So you have all these sources of data integrated into one space, and you can use these tools now to give more informative analysis in an integrated manner. So you can be able to maybe triangulate different levels of data. You can be able to monitor maybe different reasons of why maybe there is a rise or there's very high dropout rate and stuff like that. But also you can be able to make, the most important thing is to have that ability to for users to act on data and make informative decisions. That's kind of the most important thing, and I can be a witness to that, because I mean by the use of this dashboard, it has really spiked that information, the culture of using information in terms of improving data quality, and there has been quite a number of innovations that this district's managers, these program managers has been using these tools to act or to make decisions. Of course, right from the prompt decision, like maybe making decisions to resupply one facility stock with another stock, by having more of a collaborative manner of sharing resources. Some facilities are even doing more planned supervision visits. For example, one of the recent supervision that we just saw from one of the districts, that normally before they do any district, they'll just assume that I'm going to visit. I mean, essentially they plan for quarterly visits. The district managers plan for quarterly visits, which were very program centric before. So immunization manager will do his own visit. HIV manager will do their own visit. The HMIS person will do their own visit. Now it's more of a, because of this use also brings the aspect of integrated analytics. So they're not, of course, they're looking data from their program specific, but also being able to triangulate with other sources of data, with other programs of data. So that has even spiked the aspect of integrating other processes outside the use of data. So now they're doing maybe integrated supervision, and into that they even do planning out of that. And by planning, maybe we have set up some data quality dashboards where they can run and see which are the facilities that have the biggest data quality problems. And they print that out and make sure they carry the printouts when they visit the facility, and they sort of discuss the issues with them in terms of, okay, this data, yes, they did pass the validation rule, the logical validation rule, but depending on this and that, it doesn't make any sense. So yeah, so mostly things are a little bit more structured with the use of information in comparison to before, where they just used to make some anonymous decision depending on other factors and other reasons to visit the facility. So that's kind of one of the examples that has really changed the process of how the district managers, the program managers are working in comparison to before, where they did not have all these sources of data into one place in DHIS2. So I think that winds up a quick overview presentation from what I had to talk about in terms of the immunization analysis, DHIS2 apps and dashboards. So I think I can conclude here. Looking at the time, I do not think that it will be good to jump into any specific live demonstration, because that might take us another 1 hour. But yeah, so I think I'll be happy to discuss further and respond to questions and maybe share more out of the questions that might come up. Thank you very much.
Thank you so much, Ishmael. That was very insightful and just amazing, a real game changer. Because I'm just thinking of how, I'm just thinking of how in the past, or other, EPI programs have been struggling to collect data. But I think you have everything put together. Now the time has come for questions. And I think we'll pick one question, which is from Richard. His question is the DHIS2 immunization dashboard and data quality app integrated with any external systems? And what is the experience of using those dashboards for making proper decisions or planning? So there's one question there. Are you able to take it?
Yes, sure. I will assume is Richard from Tanzania? Just to confirm.
I think so. Richard, are you from Tanzania? Anyway, maybe you can just answer it.
Yeah, so because I wanted to see if I can respond more of the specific in country context or generic. So generically, DHIS2 is interoperable with external systems as a software. So that brings up the last slide that I just spoke about. So it supports the interoperability with other systems. Not only, as I said, you can connect DHIS2 with other systems like health registries. To give an example, for example, here in Tanzania now, recently we are working with interoperability between DHIS2 HMIS system with electronic immunization registry. That is, of course, being developed and supported by PATH. So through this immunization, because before we used to configure all these apps and data analysis based on the HMIS immunization form, which has been very HMIS centric and not program centric. So there is a huge gap in terms of data for program managers if you're looking from the immunization programs perspective. But through this interoperability, it means that you can be able to get not only the data that is being captured by that particular HMIS forms and only focusing on one or few HMIS immunization indicators, but also you can get additional information that can feed up into this typical analysis of triangulating data. So you can look at, for example, cold chain data, stock data, and stuff like that.
Sorry? Are you able to ask that question again? We can't hear you. Anyway, as you were saying,
yeah. So I was just trying to conclude. So in terms of responding to Richard, I think it's In terms of, is it connected? Yes, technically, because DHIS2 supports that connection. But depending on the country in a country, some country will extensively use DHIS2 as their immunization registry. It means all the data for immunization will be captured in DHIS2. That means there is no interoperability necessary. But in other countries where you would find maybe there's a separate immunization registry system, and DHIS2 is maybe more focused on the HMIS and aggregate side of things, it means the interoperability is possible for that particular exchange of data. I hope I've responded to Richard's question.
Thank you. Does that also to respond, is that the same question you also had, Subhash?
No, it's fine. Yeah, so I was just trying to understand in terms of the application. So is there, so in Tanzania, for example, what application is used by the vaccinators or frontline health workers? And my understanding is that you're using DHIS2 as a dashboard for like analyzing and viewing the data. Is that correct?
Ishmael?
Yes. So in Tanzania specifically, they are, I mean, I'm aware that there is, as I said earlier, responding to the earlier question, there is a Tanzania Immunization Registry, TIMR, that is being implemented. And this is used by the healthcare worker in terms of collecting and capturing immunization data. And later that data, of course, now we were working on that interoperability part that it sends the data to DHIS2 and it can connect with other service level and other levels of data. So in terms of looking at the healthcare worker perspective, they're only using this DHIS2, not DHIS2, immunization registry, electronic immunization registry that is based on tablets.
And then, so that is not the DHIS2 registry. So for example, parts registry that has been implemented in Zambia or in Vietnam, maybe this question is not for you, but for the overall with Kathy and other audience, like are the path registries using the DHIS2 platform?
Yeah, so that is, the application is not DHIS2 based, but it through interoperability, it sends some of the data to DHIS2.
Thank you very much. Fred, are you able to say something about that also? And I think I've seen John Richard on board. Okay.
Sorry, I didn't get the question. Sorry. Was on mute.
Oh, sorry. Subhash, are you able to repeat your question?
Oh, no, I thought that got answered. I was just asking essentially in terms of what examples are out there that are using a different registry by the vaccinators and frontline health workers and then linked to the DHIS2 platform as Ismail was showing. And I think he answered that there are examples, and I see somebody also posted that in Gambia they're using a My Child registry. And then my follow-up question was if path registries, essentially the ones that are used in Zambia and in Vietnam, if they are connected to DHIS2 or not.
Fred, are you able to pick that one up? Is your electronic immunization registry in Zambia linked to the DHIS2? I think he's dropped. And yes, of course, Gambia says that they're using an external application, and this is My Child, which is data is pulled into the DHIS2. Are there any countries that are available that would also share about this, like where they have their immunization data systems pulled into the DHIS2? Okay, do we have any other questions? Fine, I think we're currently, yes, I think we're almost like running out of time. If there are no other questions, I would like to thank everybody who's been able to join us this afternoon. Sincere apologies if we're not able to answer all of your questions, in case we haven't picked them up from the chat box. But thank you so much for taking time to join us this afternoon in this wonderful presentation on the DHIS2 applications. Really amazing. You know, I love the way it works. And a special thank you to our speaker for sharing, you know, for taking time to share this application with us. And I hope you're available to answer any questions that might come through the Big Learning Network, as well as being able to, I mean, if we do call upon you to do a proper demo, take people through a step-by-step, like you mentioned, it would take a whole hour to do a demonstration on that. We hope you're available to do that for us, Ishmael. And I would like to thank all of you for connecting with us, and would like to encourage you to continue connecting with us on all those social media platforms that we have there. And better still, would like you to join us next week on Thursday, same time, where we'll be talking about data triangulation for improved decision-making in immunization programs. And this time we'll be featuring data triangulation specialists from CDC Atlanta, and as well as WHO in Switzerland. So we'll have, for those of you who undertook any training or who missed the training on data triangulation, we'll have the facilitators from there just quickly walk us through this. So until next time, bye and take care. Stay safe from COVID. Thank you so much, Ishmael. Let's keep in touch. We'll be sharing with you any questions that come through, and we hope you'll be able to answer them through the Bit Learning Network Google Groups.